Domestic and sexual violence, which we'll refer to as DV, used to be thought of as a private family issue. What we know now is that DV is actually a public health issue. It's one of the most significant social determinants of health, affecting women, adolescent girls, and the health of our communities. On a larger scale, domestic violence strains the healthcare system, costing over $8 billion annually on injuries and health issues directly related to violence and trauma. In 2014, in response to their mission to end domestic violence and improve the health of all Californians, the Blue Shield of California Foundation developed the Domestic Violence and Healthcare Partnership Initiative. Through a competitive application process, the foundation funded 19 healthcare and domestic violence organizations across the state of California who were best positioned to engage in intentional partnerships.
Futures provided technical assistance, training, and support for the project, and we convened a unique hands-on learning network to engage all 19 partnerships and facilitate learning exchange, community, and much-needed leadership across the state.
What has come out of this project has far exceeded our initial thoughts and expectations. We've really seen leaders birthed out of this project. We've seen pioneers emerge, and we've seen so much innovation and strategy. We've seen models for cross-training developed that have had tremendous impact on practice, policy, and really the confidence and preparedness of healthcare providers and DV service providers.
Now, as a direct result of the trainings, we gain a lens to better understand the connectivity between DV and healthcare.
We've also seen grantees develop really unique models for placing advocates within healthcare settings, whether it be a major healthcare setting like Kaiser or a public health clinic, to immediately address the safety and DV support needs of patients right there as they're identified.
We were able to create an integrated response for domestic violence survivors across all entry points throughout the campus. The impact of this project was significant. We went from a medical campus that had virtually no training to our training over 2,500 social workers, medical providers, executive leaders. We're opening a shelter that is on a medical campus. This is all a direct result of the work that we've done with our partnerships.
We adopted an electronic health record probably almost 4 years ago now, and the providers are really using that. We revisited our policies and procedures. We did a training on that with our providers, and so they're able to make those referrals, and it happens instantaneously.
Before the project, we are like, even though we're a large clinic serving over 60,000 patients, we're making like 2 referrals a year. But now we're in our 3rd year. We have 200 women that disclose through our screening. It's pretty amazing, and it's really through a collaborative effort.
We've also seen unique models for integrating culturally responsive behavioral health services as a means for addressing and responding to domestic and sexual violence. Through the Domestic Violence and Healthcare Partnership, grantees pioneered the Women's Health Coach to specifically address domestic violence and effectively respond and intervene in a timely fashion within family planning and OBGYN settings.
Before the partnership, we were doing screening and prenatal intake, but that was more of check a box. Now, what we have is a much more robust model for screening that is meaningful and conversive and has been implemented in family planning and gynecology and our prenatal departments across all 8 of our locations.
One of the really fun innovations that was developed through this project was called the monthly health celebrations. This is where clinic staff actually went into domestic violence shelters and provided, in a very celebratory and positive environment, health education, and this happened in English and Spanish simultaneously. And as a result, there were actual appointment stations right there to create direct linkages into healthcare services. We've seen new materials developed, we've seen updated policies and written protocols, we've seen entire toolkits developed.
The web-based tool that we developed through this initiative, it strategically promotes partnership development in our county. and it's aligned with the recommendations of our Intimate Partner Violence Task Force. This is critical because it is building momentum to make the case for investment in this work locally.
There is no doubt that these partnerships have been effective.
The impact of these partnerships is definitely shown in the data. Before the partnership, 1 out of every 5 survivors was having their health needs met at either an emergency room or a crisis center. Since the partnership, 4 out of 5 survivors are being linked to a medical home and receiving assistance applying for health insurance. But most importantly, they're being expedited in receiving the reproductive, general, and mental health care that they need.
The sites doing this work spread the word on how to develop these partnerships and really inspire the health and DV fields to continue to come together.
We are now having different conversations with sector leaders that has led to new funding opportunities and new ways of doing business, new ways of being innovative. This partnership has positioned us to take on a leadership role to bring together these systems to address violence and community trauma and ultimately build healthier communities.
Our grantees are going out, sharing their story, showing their value in this work.
As a DV professional, it struck me when a young man and his mother were referred to Genesee. Through our partnership, we were able to treat the mother and son for their trauma-related issues, as well as make a referral to our healthcare partner. As a result, the mother received an early diagnosis of cancer and a treatment plan. Had it not been for this partnership, I'm not sure the mother would have had an early diagnosis of cancer. They're now able to make the linkage between their own personal health and how that relates to the trauma they've experienced in their relationships.
These partnerships are the answer for healthcare providers, DV advocates, and for survivors. These models, these strategies, they work. These partnerships have real value and they make a difference. They make a difference for individuals and they make a difference for communities.
I'm most excited about the move upstream towards prevention and to see these partnerships included as models for other state and national initiatives to address social determinants of health.
Partnerships are critical and very important. We have to sustain existing ones and build new ones. And we need to be transparent, build trust, and be willing to look at what's working, but also what's not working.
To make this sustainable, we need to shift our thinking away from this is a program that we run to it's part of what we do.
Establish champions in your workplace and in your community. Honor yourself, honor your process, and take care of yourself because this work is hard.
This is your call to action. We need more champions like the Blue Shield of California Foundation. We need thought leaders and policymakers to really step forward to drive this work and to make it possible for this work to continue.
Keep it moving. Share your best practices and tell your story.